Hello, and welcome to the Circuit Breakers interview series. I'm your host, Steve Semler, and today I'm joined by Dorjevski, who is the founder and CEO at Inguardia Health, a company producing an innovative biosensor solution. Vaughn, thank you so much for joining us. Would you like to kick us off with a brief background as to who you are and what you do?
Sure. Again, my name is Dorjevski, and I'm founder and CEO of Inguardia Health. We manufacture a mouth device. It's an oral device that you can place in your mouth, and we have the capacity to analyze, predict over 1,000 different parameters using the oral interfaces.
How did you get into that field and find all of the things that can be done here?
Well, when I first started the company, 5, 6 years ago, everyone thought it was crazy. They said, "Who wants to put something in their mouth? And who wants to? How can you check the saliva to check, vital health markers?" And it's funny now. The same people that thought I was crazy and they thought I was a mad scientist 5, 6 years ago, they don't think I'm so crazy anymore. And it was a lot of work, a lot of effort, working around the clock. 20 hours a day. We built all the different biosensors, the nano sensors, and so forth. And now we have the capacity to check your heart rate, your blood pressure, your sugar level, your glucose level, blood oxygen level. There's so many different parameters. We have the capacity of testing. And it's very simple. Like, you can either put the device in your mouth for a couple seconds, and we collect 5 data metrics per second. So if you keep it in your mouth for more than a second, 5 seconds, 5 seconds. 5 data matrix, 5 data metrics. We can collect a lot of different metrics over a couple minute period. And again, like my dad, he's an 80-year-old man. He refuses to go to the doctor. He says it takes him 2 hours just to get his vitals checked. So I came up with the idea, because everybody knows that skin devices are not accurate. They're unreliable. So I said, how I can come up with something that is highly effective and it works. And I came up with the sensors in your mouth, which are completely accurate. So that's why I came up with the idea. And again, I can check my dad's vitals. I live in Michigan. My dad lives in Canada. I can check everything remotely. So it's one of the main reasons it saves time, energy. And as you know, people that are, in their 80s don't have the capability of driving. So driving my dad to a doctor's appointment, you got to pay for Lyft, you got to pay for, Uber and so forth. So it's sometimes it's a hassle, but again, this way you save all that luxury. And, whether you keep the device in your mouth for couple seconds, or you can wear it all night, because we track all your sleep. We track all your sleep, your REM sleep, any disturbances in your sleep, and so forth. So you can wear it in your mouth for a couple seconds, and you can analyze it, predict, so forth, all the different features we have, or you can wear it all night. So it's up to you. Or you can wear it for a sport. You can wear it for an hour and a half. It all depends on the client.
Wow. Yeah. So how did you spot the business opportunity that would come with that solution?
Well, like I said, a couple of minutes ago, I don't want to compete against Apple. I don't want to compete against Samsung. I want my own market. So how to start your own market? It's a lot of research. And again, I said, how can I do something that nobody else is doing? Because why would I want to do something somebody else is doing? There's just too much competition. So I started researching the saliva, biosensors, nanosensors, and here we are a couple of years later. And now we built the algorithms, we built the coding, we built the app, we built the device. So now everything's changed in the last couple of years. And now we're doing something. I'm opening my own market where I don't have any competition. Yeah, there's a couple mouthguard companies that are trying to do what I'm doing, but they're geared towards sports. I want nothing to do with sports, but it's funny. These companies are trying to do what I do. They put their battery inside the device, and everybody knows that lithium, which is the main component of a battery, is toxic. So if you have a lithium battery in your mouth, and just say little Johnny bites down and playing football, it's toxic. It'll leak on your mouth. It'll kill you. So what I did with our technology was I built the battery on the outside device. So just say, you have a seizure in the middle of the night and you bite down on the device, the battery falls out. It doesn't go in your mouth. So there was a lot of thought into the process of building a device, when it comes to, all the different features, all the different components and so forth.
Yeah, taking safety into account and
Exactly.
the sensor accuracy. Yeah, wow, lots of stuff. Yeah, how did AI play into that? Because I noticed on your website you've got a little bit of AI generated there.
Yeah, well, everyone knows that AI is changing the world, and some people don't know that AI has been around since 1954, and people have not been using it to the fact that we're using it right now. And I said, what's the best way to use AI and to incorporate on devices? And with AI, we can predict heart attacks, strokes, seizures, AFib. I can go on and on. Like again, I said we got almost 1,000 different parameters we can predict using AI. So it's kind of actually scary.
Yeah. Um, so in the innovation landscape, kind of in the business landscape that keeps changing, like with AI and other things, even biomedical sensors, how do you stay open and adaptable to change? What do you do to break that circuit of the routine and stay focused on the innovation?
Yeah, the innovation aspect was, something, I'm a deep nerd, I love the tech, I love med tech. I've been a part of it for several years. And how I stay afloat is in order to be successful in a company, you have to be doing something today that's going to be advanced in the next 3 years. So to me, I know once our device is on the market, people are going to, reverse engineer it. By that, and we've already moved on to the next stage. So go ahead, copy the whatever we already built, all the algorithms, the innovation we have currently. I'm already working on stuff 2, 3 years from now. So that's the only way how to stay innovative without trying to try to give too much information. But what I have right now, it'll take companies 3, 4 years to get to. And then by the time they get to where I'm at, I'm already 3, 4 years in advance. So that's kind of, the mindset that I have in the company.
Yeah, and continuing to be the market leader in the technology and the
Yeah,
solutions.
right.
Yeah.
Because, everybody knows Apple, like an Apple Watch. But there's almost 240 different brands that people don't even know of. But Apple was the first to come up with everything. And you can go on Alibaba.com. Again, I think there was like 249 different companies that sell watches, but I look at everyone's wrist. I don't know any of those other companies except for Apple. So to me, what was important to me was to be the first, using the saliva and oral interfaces. So that's what was my goal. I want to be the first. And I know there's going to be duplicates, and I know people are going to copy my device and technology, but by then I moved on to the next device. So again, I'm well aware of that.
Yeah. And being a technology leader, a lot of folks I work with, they love the technology, but they also have to put up with the frustrations and the people side of the business, because that takes away from time they could be spending on the solutions. How do you handle that yourself? And how do you help your folks in your firm handle that?
So basically what I did was, because the app is very high tech, so everyone knows the symbol of KISS. Keep it simple, stupid. So we designed a simplistic version, which a 90-year-old person can look at the app and say, hey, I just want to check my blood pressure today. He'll click on the device. I want to check my, heart rate today. Boom. And then we have a more professional version where that way, doctors, anybody professional, nerds like me, we can check the historic data. I can check what your pulse was at 3:30 in the morning or so forth. So again, we made it simplistic version and a professional version. So that way you have features of both. And it's up to you to decide which one, you want to, play with on the device in the app.
Yeah. Are you still leading a lot of the technology work and
Yes.
development? Are you leading that, or how's that work?
Yes. I lead all the technology and all the development. We have a whole team in Switzerland, Finland, Ukraine. So, I support a whole team of developers, software engineers, architects, manufacturing, and so forth. So I lead pretty much the whole entire team.
But it sounds like that's got a lot of challenges to it, but a good
Yeah,
way to just and get the
yeah. There's a
talent
lot
you
of
need.
challenges, but it's very rewarding in the end. It's like to me, it's I designed this on a napkin sketch. I had a napkin. I'm like, I want to do this, this, and that. I want to build all these codes, and here we are. So there's a lot of challenges, but with the right team and the right mindset, anything's possible. And I mean that. Whether you're 10 years old or you're 100 years old, anything's possible because if you have the right mindset and you can vision it and you can dream it, it can happen. So that's how that's kind of what my mindset is based on.
Cool, absolutely. One of the focal point sayings we have is you can do anything. You just can't do
You can.
everything.
Yeah, you can't do everything, but you can do one thing if you just focus. But see, one thing part of it is, everyone has a great idea, like, oh man, I have this great idea, but you have to put your idea to a test, you have to put it to work, and does that idea work? And the most important thing is, can I sell this idea? And when I first started, I really didn't know if I could sell it, but in the last couple of months, I don't have a problem selling it. Distributors, different, senior living facilities, all reaching out to me and say, hey, we want this device because I'm just saying, for example, for a senior living facility, I have a father that's in a adult home care. The facility will pay for it. And here's the best part: insurance could pay for it, Medicaid. can pay for the device and it doesn't cost the patients, it's free. And then I have the capability to monitor my dad who's in a retirement home and so forth. Again, it's a win-win for the patients, a win-win for the parents, for the children, for family members. Again, it's win-win for everybody. And
it's so much easier.
Yeah, it's so much easier than taking your father, your mother, or your aunt, uncle, whatever the case may be, to a hospital or to check, to a doctor. So yeah, it saves a lot of time and effort.
Yeah. Okay. Well, if you could wave a magic wand over your business and make one thing better, what would that be?
Oh man, what will I make better? Well, every company, I'm transparent. So what could be better? I don't know, me, magic wand, that could be better. That makes sense.
All right.
Yeah, no, what could be better? Well, the technology works. Like we've tested it, for the last several months. So I can't improve the technology. It's pretty accurate. 99 point, I think, like I said, I did the math. I checked all the different biosensors on answers on a global. We had scientists and professors, with all the technology. The nanosensors and biosensors are far more accurate than any skin device. And if I can improve it, if I have to, do the one, I would like to incorporate the technology where you can scan things, where just scan the app over your whole body and give you a personal scan. But that's coming in the next 2 years. I will have that. So we're
There
working
we
on that.
go.
Yeah.
Oh, cool. What advice do you have for other aspiring entrepreneurs in the tech sector, who are just starting out or facing challenges in their businesses?
The best piece of advice I can give is don't give up. Don't listen to other people, because what I've learned in the last couple of years, first off, is not everyone has your best interest. And secondly, how can I word this? Don't share everything with everybody, because not everyone needs to know everything. So if if you have some new tech or a new, you're breaking technologies that's never been, explored before, keep that stuff to yourself, for a while. And then of course, when you manufacture, or if you're not manufacturing, if you're selling SaaS, it doesn't matter. Just don't give up and don't listen to everybody, because not everyone knows everything. And if you feel that your idea is the thing, just work on it around the clock. Don't listen to people. Oh, this ain't gonna work. Oh, how do you know it's gonna work? And if I listen to people 2-3 years ago or 4 years ago, I wouldn't be here today. And it's funny that, like I said, when I started this technology, many years ago, I really didn't know what I had. But now it's a different situation. And now I know what I have. And it's funny is that companies now are reaching out to me to buy the device. So, and I haven't even tried to sell it yet. My last year was just focusing on the development of the app, development of the technology, make sure all the components work effectively. And now it's a different ballgame. So now everything's changed. But my only advice is, do not give up and do not tell everybody everything. Just keep it, to yourself.
Yeah, because if you want to be a market leader, there's some things about you and your product and your solution that are going to keep you there.
Right. Exactly.
Keep going forward. Keep thinking forward.
Yes, absolutely.
Awesome. Well, thank you so much for your time today, Yvonne. Great meeting you, learning more about your entrepreneurial journey, and especially I'm going to let me know if I'm saying it correctly. The jaw sensor, yeah, the oral sensor.
Correct.
Neat. Yeah. So,
well, we have multiple sensors, so it's just not one sensor. We have multiple sensors and biosensors incorporating the device. But yeah, you're on the right page.
Okay, cool. Yeah, I'm actually kind of looking forward to digging in and taking a look more at the detail that's available for me.
Thank you so much. I appreciate the time.
Yeah.
To all your viewers, or if you guys have any questions, reach out to me on LinkedIn. I'll help out in any way. Like when I first started the company, nobody wanted to help me, or if they did want to help me, they wanted to charge me a premium. And in the beginning, I didn't have any money. Now it's different. But so I believe in, helping others. So if anybody has any questions on tech, how I came up with the med technology, how I came up with the device, any questions they have on manufacturing, distribution, what it costs to ship a device, I'm more than willing to help anybody. Just reach out to me on LinkedIn and send me a private message and I'll get back to you.
Absolutely. Yeah. And thank you for being willing to do that too.
Thank you. Thank you. I wish you nothing but success, Steve. Thank you so much for having me today. I appreciate it.
Thanks. And to those watching, when you're faced with challenges in your business, consider these tips. Reach out to Vaughn, and feel free to reach out to me for coaching and training support too. As always, I'm Steve Semler at FocalPoint Business Coaching, helping techies be great leaders. Look forward to seeing you in our next episode. Thanks.
Bye-bye.